following is a candidate forum conducted by the Cold Spring Area Chamber of Commerce on Thursday, October 12th. Due to technical difficulties, viewers will witness some audio interference in parts of this program. We apologize for any inconvenience this may cause for either the candidates or for you, the listening audience.
Should measures to control healthcare costs come through legislation, or should it come from the industry itself to self-manage and find ways to make it more affordable for all citizens? Paul?
Minnesota Medical Association. My campaign manager is a former Republican. Well, he's still a Republican, but he ran against Jim Peter for the state senate a number of years ago. He also represented the St. Cloud Hospital, PR person, represented and was assistant director of the St. Cloud Chamber, and was representing a number of clinics in the state of Minnesota. And he brought up something to me that the MMA is looking at as a possible way to provide universal health insurance. Number one, they would require the state or ask the state to provide a minimum amount of coverage to each resident in the state. On top of that, local insurance companies could then provide the extras that many of us who can afford it would like to have. This would take an awful a lot of uninsured off the road. It's costing, what is it, something like $400 or $500 a year if you have a family plan for the insurance companies to take up the cost for uninsured patients. That would be a savings. And I support the MMA. I think I'm one of the only ones that is talking about this program in their effort to get at least a minimum amount from the state, and then bringing in these local insurance companies. And I'm sure that if it ever hits the floor of the legislature, I wish it would, the public is going to have a good voice in how this legislation is going to be formed.
I guess I would say, just in healthcare costs in general, I think that both of those approaches are going to be necessary. The state, and I wish I could remember which of their representative candidates had mentioned it, but they talked about mandates that are put on our healthcare insurance. So that's something the state has done, so the state has to address it. And as for private industry or the healthcare industry actually addressing some of those questions, I think that they are in efficiencies and looking at ways that they can streamline their administrative costs. So I think it's a combination. But as we take a look at healthcare costs, everybody talks about healthcare costs. I think we need to distinguish the issue of, healthcare insurance and how much that is costing us, and healthcare costs in the sense that healthcare is getting expensive. It is a labor-intensive industry. The folks are highly trained, so they have to be paid more when they have the kind of training. The equipment that they purchase is very, very expensive, but you want that equipment available to you when your loved one, your mom, your dad, your kids go into the hospital, and you want the best MRI machine that there is available. And so do we really want to say we can't spend as much money in healthcare so that we get the older MRI machines, or we limit what kind of advances the hospital can make in their laser technology? I think what we can do at the state level is take a look at some of the healthcare insurance issues, and maybe we take a look at tax incentives for those businesses that are offering healthcare insurance to their folks, or make tax incentives, either deductions or reductions for those folks who are having to purchase their own health insurance. We do have several programs in the state of Minnesota that with MinCare that help reduce folks with reduced income are able to purchase MinCare healthcare insurance. And so I think if we continue to build on those, I don't know if we want to do anything that will lessen our quality of healthcare and the availability in our area, because we're very lucky to have the kind of healthcare in our area that we do.